The video you're about to see is myself and Joseph Metz a few weeks ago, where we sit down to talk about the sketchiness and the lies and deceit that goes on in the supplement industry and what to watch out for. So thanks for tuning in, and I think you're really going to enjoy this. Have a great day.
Interrupted a lot. Using mouse studies, even though that's the model study to use it to comparable to humans, mouse studies are just seeing stuff that happens in nature in general. You can't really convey that to humans to an extent. Now we're going to start off with mouse studies and stuff just to make sure it's not overly harmful for us, which is maybe against some ethics on some people's, but that's the way every single thing is produced with supplement industry and in the pharmaceutical industry. So, but when we can't extrapolate information from that to say, hey, this is the effect it's going to cause in humans.
Exactly.
And that's what you see a lot of these studies come out with.
You're probably thinking, okay, so they make these studies and they draw crazy conclusions from them. What's the big deal? Well, to people that don't understand this literature, it could be dangerous because a person in my position can tell you, take 3 CLAs a day, and you're going to lose fat. So these people keep on eating the same diet, thinking that in vitro study is their, it's dishonest.
Yeah, and it's a marketing scheme. Everybody's starting to go science based. I think because everybody understands, hey, this is what we need to start doing to get people on board. Yep. But they're using science in an unethical way. Right. And they're marketing that in an unethical way, which is the sad part of the supplement industry. That's what I don't like, and that's what you don't like.
I hate it. And guys, I'd say the greatest downfall and the greatest blessing that science can bring us is that it's ever changing.
Exactly.
Because you can take, and if you're not a science, literature reader, you can take a study from 2008 that suggests or correlates something, and we already have outdated evidence since then. So people are using this to their advantage, especially in the industry. And that's why I have a list of things that I refuse to sell.
Yeah, and that's another point. With a lot of people don't understand how an experiment is formulated and how they actually use a statistical test. A p-value of 0.05 is statistical significance, but is it clinical significance?
No. In most cases,
it's not.
Right? Yeah.
I mean, and it hurts the pharmaceutical industry. It hurts the supplement industry.
I have a few other points I'd like to kind of point out. Yeah. What happens if you're one of those big companies, and like we've seen since 2008, the initial pro-hormone ban, and then 2014 we had the final cut. What happens if you have 50,000 tons of product sitting around in a warehouse? What are you going to do? Yeah. If you're relying on hundreds of thousands of dollars of income, you're going to keep selling the illegal products, calling it something else.
Yeah, you're going to, and you're going to see a derivative of it. Maybe they use that chemical compound, and they start maybe slightly modifying it just to put an extra functional group that still acts the same way, but now a different compound.
Hey, I mean, I'm not gonna say any chemical names, but DMHA. I mean, I love it, but at the same time, we're running into that same issue where I'm playing cat and mouse with the FDA. I'm not afraid to say that. We want to keep it legal as long as possible. People are just irresponsible.
You've got to find a fine line if using it is beneficial for a workout, or is it
for a high. We're not taking these to get high. We're taking these to actually see a benefit, and that's one reason why we did like the Prevail so much, because it's not going to crack you out, guys.
It's not. It might get a little itching from the beta alanine, but that's it. Like you're not gonna have a crazy crash that you might get on some stimulants too.
Yeah. Ooh, one more thing. Personal testimony is not objective evidence. Okay.
Very subjective.
Your grandma losing 50 pounds because of an isogenics shake or program is not subjective or objective evidence.
Schemes that cause issues in the industry is people that say that something works because it works for them, whether it works for them or not. I'm not saying it doesn't. I'm not saying it does. But it's not going to say it has no evidence to show that it works for you. Yeah. But if it does, it does. And I hate bashing other companies, and I try not to, and we're very respectful of other companies. But they've got to learn that it can't be just a pure marketing scheme that we're going to put something, force you down because we want money. To me, you can't market a product ethically if we're just saying we're going to cause a pump, but we're not giving you the proper ingredients to cause that pump.
Exactly. And I think that is the consensus of the industry. There are no ethics in a lot of the realms, and I think that's why I wanted to sit down and just kind of pass ideas back and forth here, because that's a big problem that we face, and people lose trust in people like us. Because they expect to be sold on something that's bull.
And then we can't give them $40, $37 for a pre-workout is a reasonable price, but when you have other products selling it for $17,
Yep.
So then we get in an issue like, why are yours so more expensive? But it's because we have the proper stuff
dosage
in it.
Yeah, exactly. But anyway, guys, hope you have a great day, and thanks again, Joseph, for coming on, man.
it.
It's been a great time.
We'll see you.
We'll see you later.